afternoon. My name is Claudia. I'm going to be your student nurse for today. I'm going to do my hand hygiene first before anything. So today we're going over the nose, the mouth, and the throat. And I'm just going to start off by asking you a few questions first. First, have you been experiencing any unusually frequent colds?
No.
No? Okay. Do you suffer from any allergies?
No.
Okay. So for the first portion, we're going to start off with the nose. We're just looking at the nose in general. So we can see that it's in the midline. We don't see any inflammation. We don't see any discoloration. It's nice and symmetrical. We can also, when you're looking up, I also want to look at the septum for any deviation, but there's no deviation. It's nice and centered in the midline. So from here, I can also palpate the nose for any lumps or tenderness or masses. Does that hurt?
No.
Okay. So from here, I am going to palpate the frontal sinuses and the maxillary sinuses. Does that hurt at all?
No.
No? Okay. So that is normal. I also want to make sure that both of our nostrils are nice and patent. So I'm going to have you close one nose, and I'm going to have you breathe in. And then do it with the other one, and breathe in. Did you have any difficulty breathing?
No.
Okay. So nostrils are nice and patent. After that, I'm going to move on to the mouth and throat. And first, just by looking at the lips, they are nice and pink. They are moist, and I don't see any lesions or cracks. And then if you could smile for me and open your mouth. So I see that the teeth are nice and white. They are aligned evenly. I don't see any missing teeth or any dental caries, so that's normal. From here, if you can open your mouth back up, I am going to be inspecting. So I'm looking at the tongue. The top part of the tongue is supposed to be rigid and pink. And the bottom of the tongue, which is the ventral side of the tongue, it's supposed to be veiny and shiny. And I'm also looking at the bottom of the mouth, which is the most popular site for any cancers. And I'm also looking for any lesions there, but it's nice, pink, and moist. So if you can open your mouth back up. I am also checking the buccal mucosa, so I'm checking the side of the mouth there for any lesions, but it is nice, pink, and moist. I am also looking in the back. I'm looking at the uvula. Hold on, I'm looking down at the uvula. It's in the midline. It is pink. I'm also looking at the tonsils while I'm back there. They are not enlarged. They are also pink, so that is normal. I'm also, while I'm in there, looking at the top palate, or the top two palates. So the front palate is our hard palate, and that should be whiter in color. The back palate is our soft palate, and that should be pinker in color. So that is normal. After that, I would like for my patient to open wide and say ah. And there we're testing the cranial nerve 9 and 10, and there we're making sure that our uvula and our soft palate rise. And lastly, lastly, I'm just gonna have the patient stick out your tongue, and I'm just making sure that it's in the midline and that we are testing cranial nerve number 12. So thank you for watching my assessment.
Thank you.